Welcome to our show, coming to you from Milan, Italy. You know we love to connect you with amazing places around the world. But another thing is we love to keep you healthy. And now it's time for Health Beat. And joining us now is Dr. James and Scott that are going to tell us about a concern when it comes to our eyesight. Gentlemen, welcome to Get Connected.
Hi,
Morning,
Con.
Well, gentlemen, it's certainly great to have you with us. Now tell us about this eye convention that you all are attending.
There is an exciting national conference called the American Academy of Ophthalmology in Orlando. And what we're trying to do there is really communicate all the recent advances in glaucoma and eye care to the entire vision community.
And actually what we've done in this particular case, because of the huge incidence of glaucoma, and as probably many of your viewers are aware, it's a situation where over 60 million people currently have glaucoma. But even more importantly, given the fact that glaucoma is a disease of the aging population with the baby boomers who are aging, we're projecting that by 2020, that over 80 million people will have glaucoma, which is why this particular partnership has been established to create additional awareness. And the project is called Take on Glaucoma. There is a website that your viewers can go to, which is called takeonglaucoma.com. There's all kinds of information about the disease, about diagnostics, and obviously treatments to make sure that glaucoma does not progress any further.
Great. Well, Scott, you run a glaucoma foundation. What is our call to action today?
My biggest concern is, there are actually two, honestly. First of all, glaucoma is first of all, it's a series of diseases, not just one. And it's really not understood properly. And the reason for that is that glaucoma has no symptoms. So unless a person is diagnosed and then goes on a regimen, or notices that they've lost their eyesight, and to have that happen, they need to lose 30%. It's a situation where the loss of that eyesight is not retrievable, which really is a tragedy. But my biggest concern, honestly, as I mentioned just a moment ago with those statistics, is that there's going to be a huge increase because of the age situation with glaucoma, and patients are not aware of it, and I'm not sure that exactly there are going to be enough eye care professionals to take care of all the people that need care for glaucoma.
You know, Dr. James, what exactly is glaucoma?
Glaucoma is a disease that can actually rob you of your side vision first. And the interesting thing about glaucoma is that it is oftentimes asymptomatic. There are no symptoms, and so that's why it's important to get in to see your eye care provider and have a dilated comprehensive eye exam where there's dilation to look at the optic nerve and also eye pressure readings.
Con, one thing I might add to that is that until 5 to 7 years ago, it was a situation where many of the eye care professionals did not understand glaucoma. And given the fact that one of the causal factors is elevated eye pressure, as Dr. Sai mentioned, it was a situation where what they would often do is what we call a puff test. And if it turned out that the person's eye pressure was not elevated, they moved on. But we've since determined very solidly that people can have regular pressure glaucoma or low pressure glaucoma. And that's why it's so important for the patient to educate themselves and insist upon, as Dr. Sai mentioned, a fully dilated exam when they go see the eye care professional. Because if they don't ask about it, it may not happen, and the glaucoma that they perhaps have may go undiagnosed.
Now, you mentioned that there were no symptoms that would allow us to go lead to the diagnosis. So who and where should we go to get the test?
Those who should get a test include patients who are over the age of 40, patients who actually have a family history of glaucoma. And also, if you're African American or Hispanic, you're at increased risk of developing glaucoma. Also, if you're nearsighted, myopic, you should get tested for glaucoma. And as Scott mentioned, even though elevated eye pressure is a risk factor for glaucoma, you can still develop glaucoma even if you have normal or low eye pressures. So I think everyone is at risk for developing glaucoma, and that's why it's important to see your eye care physician and get a comprehensive dilated eye exam.
Con, I might add just a point or two on that particular issue, and that is that if you're over 40, it's suggested that you get your eyes examined every other year, and if you're 60 or above, that it be done every year. But as with many other diseases, it's important for your physician or eye care professional to establish a baseline. So even if you don't have glaucoma, they take pictures of the optic nerve, which is obviously the area of the eye that's impacted by glaucoma, and even if everything is normal, which we certainly hope it is, that is the baseline for any further exams or any progression that might be diagnosed later.
Now, if we are diagnosed with glaucoma, what are the options for treatment?
Con, the important news is that there are effective treatments today for glaucoma. And these include eye drops, which lower the eye pressure, laser surgery, which lowers the eye pressure, and even incisional surgery, which lowers eye pressure. The important thing is to be diagnosed early and then tailor a treatment plan with your eye care professional to lower the eye pressure and reduce the risk of developing vision loss from glaucoma. As Scott has mentioned, it's important for patients to learn as much about their disease and to make glaucoma a health priority. And you can go to the website takeonglaucoma.com to gain further information.
Well, Doctor, thanks for your tips. Scott, for running such a great foundation. And it was great to have both of you with us today.
Thank you very much, Scott. Appreciate it.
That's one thing we all have in common. We got to keep ourselves healthy. So what? We can travel the world together. We're getting you connected with Milan, the second largest city in Italy, and home to Prada, Gucci, Armani, Versace, Valentino, and so many other fashion houses as we bring you here for Fashion Week. It's going to change the world and set the trends, and we're going to be on the cutting edge together when we come back. Thank you so much for watching. Are you tired of negative news? We are.
And that's why we're creating a movement.
By keeping it real.
With what you need to know.
It's more than what's happening.
It's bringing hope back to our lives.
So go to contv.com and join our movement.